All right, guys, it's 9 a.m. Yes, big smiles from Vasudeva. Very good. You got up early today, so hopefully you'll be firing on all six cylinders this morning. So today we are reviewing all of your lectures in institutional pharmacy management, and we're going to look at your first in course exam, and that should be it for teaching and covering everything for institutional pharmacy management. So let's get right into it. Um, so this just like yesterday, this may be the third or fourth time we're going through these slides, so that we'll go through them quickly. And I have a. Actually, I shouldn't let the cat out of the bag, because this could actually be a nice, even though it's already submitted. I wonder if I can change it, because I recently came across a public health issue in the States, that we could have used I could have used to ask a question for your exams. Maybe I'll use it if I have to teach in semester one, in next 2 months. But it would be a great exercise to use it based on the teaching of public health. So all right, so let's go. All right, so public health has many complex, or many definitions. We looked at a nice concise definition that nice concise definition would be a social institution, a discipline, and a practice. Definitions before that on slide number 9 talk about health activities, social values, goals of reducing the amount of disease, premature death, and disease-produced discomfort, disability in the population. So public health essentially, to put it in your own words, if you can, based on all of these definitions here from slides 1 all the way to 8, is essentially a practice of ensuring that a community collectively has efforts being made to ensure reduction in disability, reduction in mortality, and overall improvement in healthcare status of the community. All right. So the functions of public health, these functions are important. Several questions came from it. To monitor health status, to identify community health problems, diagnose and investigate health hazards in the community, inform, educate, and empower people about health issues, mobilizing community partnerships to identify and solve problems, community partnerships, develop policies and plans that support individual and community health efforts. So understand, and I hope you appreciate that public health has a huge community. And we say community in a sense just so that you can understand, but it's not just only your community of where you live, whether be it Arima, whether be it Chaguanas, whether be it Debe, whether be it Point, whether be it Mayaro, wherever it is. It's not just your community alone, but public health speaks to the national, from a national perspective as well. Yes, there will be specific things that affect a community, but um, public health treats with the national health discourse, enforcing laws and regulations that protect health and ensure safety. And I want to ask a question now from you guys, um, based on this slide number 13.1. Enforce laws and regulations that protect health and ensure safety. Was this done with asking a question here, guys. Slide number slide number 13.1. An essential public health function to enforce laws and regulations that protect health and ensure safety. Was that done within recent times regarding our coronavirus status? Nicolette says yes. Matthew says regulations were enforced by police. So Matthew says yes. I'm talking recently, as in last week, week before. So, and no laws but policies. No, Melissa, there were laws. There were laws. So, the laws that spoke about, right, the laws that spoke about closure of certain businesses, the laws that spoke about the times that businesses ought to close, the laws that spoke about mass gatherings of persons more than of groups more than 10. Those were real laws that if you were caught doing, you could have been prosecuted. And a regulation of the law, just further statements to help reinforce the main law. So Vasudeva is saying no, people will enter without mask, not in them political rallies. But Benny's right. To self Vasudeva. What? All right. So Vasudeva is correct. I'm not fully understanding the last part that he said there, but with regard to enforcing the laws, our borders were closed. Our official borders were closed. Yes, we are aware that there are unofficial borders. Were they being monitored? Were they being manned? Did the authorities? Yes, Vasudeva, I saw the video and I'm aware of it. Thank you. Did the authorities charged with the responsibility of monitoring those illegal, well, there are illegal and illegal borders? Were they able to get beyond their personal interests and really and actually treat with those porous borders? The answer to that question is no, is a resounding no. Because officially our borders were closed, so no persons were officially coming into the country that could have brought coronavirus to us. But you would have seen on social media that there was one guy whose face was posted all over social media. I don't know how legal that is on. I don't think it's actually very legal. Um, but it depends if the police put up the person's picture and ask for information regarding his whereabouts, um, and they would like to meet with him. That's totally legal. But to put up his picture and say this person is responsible for bringing in illegal immigrants, and this person, we are looking at him because he may have contracted coronavirus and may have been the root cause of spread, then that may be illegal just to come out and say that. But the point I'm making is our Coast Guard, our police, our immigration, or whoever else is charged with the responsibility of monitoring these borders, they didn't. And I can tell you for a fact, yes, there were videos, Chagaramas, as well as down Deep South, Rancho Quemado, Mon Diablo. Those are places in Erin. Icacos, Cedros, sometimes even Moruga. Persons were coming in illegally. And we know that Venezuela is right now in crisis, health-wise and otherwise. And we have continuous increase in cases in Venezuela. And imagine, I want you to imagine for a moment, Venezuela is in a crisis economically, from a health perspective, from a national security perspective. Vasudeva, I'm not aware of that one. But okay, that all of those things are to be considered as well. Um, so Venezuela, they claims to have come to to our country and offered us test kits, right? Okay, but they are a country in crisis, and they are only be able they identifying 12,000 cases. A country with 17 million people, 17 million people, has 12,000 cases, and they are a country that's already scarce on resources. So we don't know how much other persons are there positive and symptomatic or asymptomatic, and these persons are allowed to come to our country. So we're discussing this discussing this to talk about this first point about enforcing laws and regulations that protect health and ensure safety. That's actually this could actually be a really nice structured question for you all. Explain using public health what went wrong with recently with our upsurge in cases in Trinidad and Tobago. So that's why we're having this discussion. Second point, linking people to needed personal health services that ensure the provision of healthcare where otherwise unavailable. Assuring a competent public healthcare workforce, evaluating effectiveness and and quality of personal and population-based health services. Research. And now we go on to how do we take a public health approach? And as I said, there was a very similar incident took place. It has taken place in the U.S. regarding similarly to the example in this lecture. Um, Sorry about that. Yeah, where you have to take a public health approach to an issue. And in this case, in this lecture, we looked at drownings in pools. So you have to define the health problem. What is the problem? What is the health problem we are looking at? What is the health problem that's causing disability or mortality of children, mortality of mothers, mortality of males, mortality of females, mortality of adolescents? Define the health problem. Is the health problem sharp rise in persons with pulmonary diseases? Is the health problem a sharp rise in persons with cardiac diseases? Identify the risk factors associated with the problem. Develop and test community level interventions to control or prevent the cause of the problem. Let's just use an example of cardiovascular diseases. So we are ranked very high in the world per capita regarding cardiovascular diseases. Heart failure, heart attack, ischemic heart disease, transient ischemic attacks, angina, the works. All right. So we define the health problem. The health problem is cardiac disease, heart disease, heart diseases. Identify the risk factors associated with the problem. Let's start with some risk factors. One, the consumption of foods that are high in trans fats, that are high in cholesterol, namely we in Trinidad, we love KFC, we love Royal Castle, we love fried chicken generally. We love pizza. In our country alone, we have 5 international Papa John's, Domino's, Pizza Hut. Okay, so we have 3 international pizza brands in Trinidad, and we have 2 local pizza brands. Yeah, right. So we have a huge concern. And then let's talk about those of us who like Vasudeva. Are you there? I'm sure. I'm just asking. It's an association I'm making, and I could be very wrong. You said that you're a vegetarian, so I'm assuming that. Is it safe to assume that you're religious as well in terms of a religious Hindu person? Tell me, Vasudeva. Oh, Sarvish is vegetarian. My apologies. My apologies. Okay. So, well, the point I was trying to get at is, although you might be vegetarian, right? Makes, yeah, I guess so. Yeah. Okay. Okay, Vasudeva, you eat KFC. So the point I was trying to get at is, although you might be a vegetarian, which means that you're not consuming animal meat itself in its raw form, well cooked form, for in getting cholesterol, you will have, and I'm using this because this is the reality. I know someone, one of my staff members who is very I wouldn't say religious, but attends a lot of prayers and weddings and those things. And there's a lot of paratha roti or basapshat consumed. There's a lot of curry and oil-based curry consumed. There is a lot of parsad consumed, which contains ghee, which is pure um, uh, uh, animal product that is high in cholesterol. So the point I'm making is, what are the risk factors? Our consumption habits. Either you either vegetarian or not, you still consume a lot of products that aren't healthy for your heart. Another risk factor. Do you all know that um, it has been recently found that being of South Indian descent, being of South Indian descent from India, you are considered to be high risk of developing dyslipidemias. So that's another risk factor. All right. Um, and another risk factor would be the excessive amount of alcohol consumption our population consumes, lack of exercise, and I think smoking is also an issue. So those are some risk factors. Development, and we can use another risk factor or developing cardiac disease as anxiety. We live in a high crime society, and high crime society would obviously have higher anxiety rates amongst the population. Develop and test community level interventions to control or prevent. So you can develop some community level interventions, restrict the amount of establishments that sell unhealthy food, or at those establishments, your public health department work with these restaurants to get their meals healthier. And these are meant to control or prevent the cause of the problem. So we can say as well, and I can tell you as well, the CDAP program, the Chronic Disease Assistance Program, was meant to give better access to chronic disease medication for the entire population, with the hope of reducing the burden of chronic disease in years to come from those illnesses. Understand what I'm saying? Remember, I said it is it is cheaper to prevent a problem than to treat a problem. Just as it's easier to retain someone than to recruit someone in HR. So it's easier to prevent an illness rather than treat an illness, because when you have to treat an illness, it's a whole lot more complications that come about. All right. So the CDAP program is another example of where you develop a community-based approach to hopefully reduce or prevent the cause of the problem. So I hope you all understood the points in that we just made there. All right. Um, Monitor these interventions for effectiveness. So it's define, identify, develop and test, implement, monitor. All right, and you'll see it in slide 17. Nice stepwise approach on how we go about with the public health approach. Remember, the public health approach requires the collection of data. What, where, when, who, how. What, where, when, who, how. You have to ask: is this something preventable or not preventable? Is this controllable or not controllable? And I want to put out there to you guys. There are some quarters that are arguing that coronavirus is not preventable. They are saying that it's inevitable that we will all get coronavirus one day, so what the hell? Let's just get it now. Immediately you can say to yourself, and 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 there's a country that a first world country that is actually taking this approach. Sweden is taking this approach. Um, so you can ask yourself, yes, we may all contract coronavirus now or in the future, but when would be the better time if it is we were to contract it? Would it be now when we know little about the disease and we know little about treatment and management, or would it be later when time would have passed and we would have become better at managing it? Herd immunity, Matthew. Yes, herd immunity is something that some persons have spoken about it from the beginning of this pandemic, and some persons have spoken against it. We speak against. I am one of those that speak against it. I speak against it because who is the persons who are? What about the persons who become collateral damage during our attempt at herd immunity? Your granddaddy and grandmommy or auntie, your niece who probably is immunocompromised, your neighbor, your teacher. These are persons who will have to inevitably perish as we attempt to expose everyone to the virus to develop herd immunity. So herd immunity is an old concept that should not be used for dangerous diseases such as coronavirus. All right. Matthew, I want to correct you. You can't contract the virus multiple times. What you're probably getting confused with is that persons who were coronavirus positive after becoming well and they get retested, there is genetic junk remaining in the body, whether be it in the nasal swab or wherever they do the testing, and those things create positive results. So it's not as though you're contracting the virus again. You contract the virus, and once you recover, your body would have built immunity to the virus. And if you test positive in the future, well, in the near future, it's really because of genetic junk. Okay, Vasudeva, it is little, right? Little is known about the virus. Can't say if it's better to get it now. I can tell you, I can tell you, it's really better not. It's really not better to get it now, because if you get it now, you we are making attempts to help treat and manage you. Okay. And this public health approach to coronavirus the world over is such a controversial thing, and I hope when I read some of your literature reviews that I see some information that really gives a critical analysis of how this approach, or how it was managed from the World Health Organization down to specific countries, how they managed it. Yes, Firaz, there are long-term complications if you all were following coronavirus from the beginning. Coronavirus apparently can cause damage to several organs of the body. So you might survive, but you might have extensive damage to several organs, including the heart, the kidneys, the liver. Yes, correct? Right? Yes, Matthew, correct. Right, good. So moving on. Um, right, so coronavirus is preventable. And it's preventable in the sense of if you have on your mask and you exercise good hygiene discipline, you could be in the room right next to me. You can cough, you can sneeze in your mask, and I will not contract coronavirus. And that's the whole point of taking preventative measures to contain the spread. So it is controllable, it is preventable. These are questions specifically about coronavirus. We talk about having a plan A plan is a blueprint of your strategy of what you're going to do, how you're going to do, when you're going to do. I'm repeating this because I've read some of your farm admin assignments last night, and I was hoping in all the answers to see that a plan is a blueprint. A plan is a specific step by step approach or an overall. We could go plans supposed to be specific, right? An approach on how something is going to get done. It requires a champion, someone who is, and we use the word mascot, yes, but it does not have to be a mascot. It could be someone who is really pushing it. Someone who is living and breathing the issue and who is telling everybody about the issue and who's encouraging everybody about the issue. A strategy and method. Well, the strategy and method is linked to your plan, the will, and funding. Just do it. And after you have to evaluate, did the strategy work? Were the results as expected? Can you expand or replicate the program in another instance? Do you abandon or revise and try again? And then we went on to discuss the public health issue of the leading cause of death in children between 0 and 4 years in Arizona in 1986 to 1996. And you can go through this. We don't have to go through. You can go through it. And the findings were there were no fence, there was no supervision, um, and then right barrier and supervision was the two problems. High priority, you don't want your babies drowning. Nobody wants to see to have babies drowning. Is it preventable? Yes. And they develop these things with legislation to ensure that if you're building a pool, you must build with it a fence. And just a side note, because we're talking public health as well, it might be a good idea to legislate as well in our country that if you're building a house or an apartment complex or condo or whatever it is, that you must have water storage tanks and a pumping mechanism to supply your household, because we can't rely on WASA for continuous supply of water, right? That's just a side of how you can legislate to ensure certain things get done for public health. And water is essential. It's a universal solvent. Water is essential for sanitizing, for bathing, for cleaning, for washing, for cooking. I'm getting some real great ideas here for questions on public health. So if I am teaching the next semester, I will definitely consider these. Right. And the last part about evaluation and maintaining, you would see in the same example of the drownings in Arizona, that they fail to maintain the barriers, they fail to continue the whole method of supervising children. Parents went back to being unattentive to their kids, and in some states they dropped the whole requirement for barriers and interior pools and all of those things, and drowning started back. So that's where you have to go back to the drawing board and continue until you get it right. Good so far. Any questions so far on that first lecture? If we have no questions, I'll be moving on straight to the second lecture. Thirty more seconds before anybody send a question for this first lecture, and then I'm going to start the second lecture. Okay, good. No questions. Let's go. So we are on to health ICT, and this lecture introduced the concept of equity, and we spoke about health ICT, and ICT is information communications technology, and how it can help in bringing about equity in healthcare. All right, and this slide number 2 showed the examples of what equality is, what equity is, what reality is, and what liberation is. And we spoke extensively on what we currently have, which is health equality, and what we should have, which is health equity. All right, and the reality of what equality can lead to, which is, persons who really absolutely don't need any assistance get and take all the assistance they could, and really put the persons who need the assistance in the worst disadvantaged position. All right, so we have a list of health threats that are affecting the population, and I'm sure when this PowerPoint presentation was done, we never would have thought of a ravaging epidemic and now a pandemic in the world. Infant and maternal mortality is a real issue, especially in our country and in developing states. Deteriorating healthcare facilities, just as in our country and developing states. Malaria, tuberculosis, and other infectious diseases. Malaria is prevalent right at our neighbor in Guyana. Malaria is very much present. And we have increasing demands for funds, training for doctors, construction of new facilities. All of these are issues and problems faced by the healthcare sector. Declining resources, rapidly expanding medical knowledge, and poor communication between facilities. The health sector is very much information intensive, just as the security sector is information intensive. You always need to have take histories of your patients. You always need to be aware and updated as to their disease status. You always should be aware and updated as to the lifestyle adjustments that they may have made and the medication treatments that may have changed during a particular period. So advances in information communication technology could provide fast, cheap, efficient access to information. And this ICT application in any sector, whether it be construction, security, health, we're talking about health today, would bring about speed, would bring about efficiency, would bring about cheap access. And to tie in to pharmacy administration and management, we all know that management is about achieving the organization's goal in an effective and efficient manner. Effective and efficient manner. Clearly, ICT must play a role because ICT is a known tool to provide or to ensure that you operate with speed and with efficacy. So ICT helps with decision making, um, exchanging information amongst peers, providing professional support, and you will see later on in our review, um, self-care management and ICT applications, telemedicine, EMRs, electronic medical records. And ICT would help to mitigate the shortage of workers. And we use the example of radiology. Radiology, you can take a scan here in Trinidad and Tobago and have it soft copy sent to a country where there are radiologists that are ready to report on your scan. And you don't need to have a physical radiologist all the way in a remote area, or you don't have to wait several days for a radiologist to be available to report on your scan. And the bottom part of slide number 9, ICT is flexible, interactive, and can reach a large population. ICT can help balance the disparity between urban and rural. Remember, urban is developed like a city or a borough, as we would have in Trinidad, or a developed town versus a rural community that is developing or underdeveloped. Usually, rural communities get the ends of resources because usually sometimes the sheer distance to get there is a challenge. You would hear the term rural neglect. Let me put that in there. So if you want, you could look it up. Rural neglect. It's a term that is bounced around elections time. Um, it's a term that gets used and abused, but essentially it's persons who live in rural communities, and again, rural communities are those that are small and remote. Remote meaning far from uh, far from the city areas. So you look at the seaside communities, Toko, Guayaguari, Mayaro, Rio Claro, Point, Cedros, Irin, Las Cuevas, all of far off communities are considered to be rural communities, and these communities always complain of rural neglect because they don't get the amount of attention and resources that the urban areas get. So ICT can help to bridge that, and ICT can bring access to services to those areas without having the physical needs of a full complement of healthcare staff to get there. We had an introduction here to primary healthcare, equitable healthcare approach. All right, so essentially ICT, and I mentioned to you that over a decade ago, when I was completing my masters, we were lectured by the consultants that came to Trinidad and Tobago to implement and roll out a national healthcare system of ICT. I think all the proposals were done, and I think it's sitting somewhere on a shelf gathering dust. Political will. Political political will in this instance, I think, is the reason why the national healthcare system, IT-based system, was not rolled out. And these are the type of challenges that you're going to face in public health. When you become a public health manager, I urge you to use your political will, use your management will to get things done. There was something I wanted to remind you of, and it just escaped me, but it was a story of why Singapore was able to succeed in becoming and moving from a underdeveloped third world country into a first world country in a short space of time, in 40 years. Um, it was three words. If I get it, I will send it to you all. All right, I'll send it to you all in the WhatsApp group. All right, so that's ICT, health ICT. Any questions on ICT? We're going to move on to the next lecture, human resources in health, in human resources development. I think I may have this saved in my saved. Much later. Vasudeva, what do you think virtual I think it's an excellent idea, Vasudeva. I think it's an excellent idea, and I'm happy you brought this up. This is something that even just about 10 years ago, I've said to myself, and this is actually a business that I am considering. I'm thinking about being able to create virtual patient counseling, just as we are right now. You don't physically need to be in the presence of someone to counsel them. Right here in the front of your camera, the only thing you won't be doing is being able to touch the person, and in counseling, there is no touching. It's about discussing. You might be able to look at an issue on their body or their prescription, and you can discuss with them. So virtual patient counseling is an excellent idea. It would definitely reduce the time that is needed for someone to go into a remote area or even an urbanized area to remain. Let's just say you're working in a pretty hot city, a dangerous city. You'd want to reduce the amount of time that you spend there so you can have the medications packaged, checked, supervised, and given out, and you can do your patient counseling later on. It's an innovative approach, but I want you to be aware that there are some dinosaurs that will be against this approach. Dinosaurs in the profession that you are about to enter into that would fight against this. However, the young persons that you all are should always push forward with your innovative agenda. Be innovative. There is no need to maintain the status quo if the status quo is not relevant. And I urge you all to continue being innovative, to continue being bringing new solutions to old problems, to continue doing things to improve efficiency and effectiveness. So yes, Vasudeva, it's a great idea. It's something that hopefully I can work on getting done as a business or as a service or as a solution. But yes. Any other questions before we move on? No questions. Okay, Melissa. All right, let's go. I'm looking at my saved YouTube videos here to see if I can get that for you all to take a look at, because it's right. I got it. Older persons don't know how to use technology. Yes, Melissa. Older persons are afraid, and sometimes younger persons as well, but generally the older generation are averse to technology. I remember my mother had an issue with using a television remote. A television remote, right? It took her 3 years to get familiar with a television remote. But yes, the older folks, they believe that they are vanguards to an old system that must be preserved, that must be kept. And when you apply modern day logic, it makes no sense to maintain. And it's an old method, it's an inefficient method, it's a useless method, it's all sorts of things that you can say to make the point of changing it, improving it, augmenting it, developing it. But they are going to fight you back. Okay? Well, Vasudeva, the business is the counseling that you will. I'm just gonna throw it out there to you. Imagine. I don't know how much of you would have booked a flight and a hotel somewhere online, right? So there's Travelocity, there's Kayak, there is Expedia, there is Hotels.com. All of these companies all compete for the same hotel room, right? But whoever gets the booking, they get the money. So as pharmacists, we can be like the Expedia, Travelocity, Kayak, and Hotels.com and TripAdvisor.com, where we all vie for someone seeking our advice on their medication. And if we get selected, we get paid. That's the business, Vasudeva. That's the business. What you're talking about there is very basic. Yes, someone can take your advice and go to another pharmacy. That's okay. But they are paying you to get your advice, or you are being paid. Another way is this: all pharmacies subscribe to a company that hosts hundreds of pharmacists. So all pharmacies in Trinidad and Tobago subscribe to, or they have a business relationship with a company called pharmacycounseling.com. Pharmacycounseling.com now. This is actually a discussion we should have had in community class. So a patient goes into a pharmacy, right? It's whatever labels it generated, everything checked, and they given, because patients don't like to stay in a pharmacy long. They could stay hours by the doctor, they could stay hours by the lawyer, they can stay hours to line up for a movie, but when they reach in the pharmacy, oh God, we're taking so long for. You all know that, right? But you all will see that. So they go home, and when they go home now, in the comfort of their home, because that's where they want to be, they take out their medication and they see a phone number, they see an email address, they see a WhatsApp number that they can contact now for counseling. And for each counseling request that the company called pharmacycounseling.com gets, they get paid. And they get paid by perhaps the pharmacy where the medication was received from, or all pharmacies in the country pay a premium every month, a small premium every month, just like Netflix. Just like Netflix. Small money, $15 US per month, access to hundreds of movies. But small money, $15 US per month, in a world of for a customer base of approximately 1 billion people. Think about that revenue. So I'm glad we had this discussion. I wish we did this yesterday. Vasudeva, you could have brought this up yesterday. This would have been perfect for community. But that's okay. Although you're doing institutional, it's about having a mindset that is innovative. It's about, that's my idea. I will put you in court for intellectual property theft. That's my idea. Um, it's about having that mindset of being innovative. And yes, you might be in a hospital setting, you might be in a public setting, but you might decide to leave and start this entrepreneurial activity that we just spoke about of patient counseling. All right. So great. I see it's 10 to 10. So let's take a break and we shall return at 10 o'clock. Good. Nice discussion. Nice discussion. It was exciting just now there. And that's how exciting entrepreneurship is. When you have an idea, or when you have people that support or coming together with a brainstorming, it's a really exciting thing. So I'll see you on the other end of 10 o'clock.